diverticulosis, diverticulitis. My mother has colitis. Diverticulosis and its associated complications has to be one of the most common things that we see in clinic as a gastroenterologist. I saw 3 patients in clinic this morning with diverticulosis, diverticulitis related complications, and then I scoped another 3 patients in the hospital with diverticular bleeding this afternoon. And from a provider perspective, from a gastroenterology perspective, it's very interesting the questions my patients ask to me. So I was curious, what information do my patients look at on the internet? And I'm going to provide a little commentary for some TikTok, YouTube video, and Reddit posts that you may find beneficial. So without further ado, let's get right into it, starting with a TikTok video from Dr. Henry Herrera.
Dr. Ed, a gastroenterologist. So today I'm showing you a colonoscopy for a patient that was done for screening purposes, but more importantly, I want to show you a disease process called diverticulosis. So this little pocket right here is the diverticulum. You put more than one diverticulum together, diverticulosis. So diverticulosis is a condition where there are weak.
So first of all, I hope that Dr. Herrera makes a follow-up TikTok video about his workout regimen, because this guy's got a physique on him. He's just basically suctioning all the stool in the colon at the moment. This is just left over from the prep, flushing out all the poop in the colon.
Points along the musculature in the colon, typically on the left side of the colon, and that leads to these pockets. Now, these pockets are typically asymptomatic unless they become infected. When they become infected, it's a condition called diverticulitis. So anything with itis at the end means inflammation of. So inflammation of diverticulosis. Now, these pockets do not pose any increased risk for colon cancer, but they are important to note because if you start developing diverticulitis, then you may potentially be looking at surgery in the future if you continue to have episodes. Now, typically diverticulitis is treated with antibiotics for about 10 to 14 days. Diverticulosis is just managed conservatively.
So I agree with most everything he's saying. A couple points. He's right that diverticulosis tends to occur in the distal part of the colon, and the name for that is the sigmoid colon. However, I do see many cases that are in the proximal or ascending colon, so it can happen on the right side as well. He's also correct that most cases are treated with antibiotics, although more recent evidence has showed that if the patient is healthy and not that sick, sometimes it can be managed with supportive care, just increasing the amount of water and vegetables, and it tends to resolve on its own. Typically, we find that surgery is only reserved for patients that have repeated attacks, 2, 3, 4 attacks of diverticulitis.
We always recommend having an increased fiber in your diet. Make sure you have regular bowel movements. Now, with regards to risk factors for diverticulosis, increasing age, BMI, male sex have been associated. But really more importantly, just make sure you're aware of it. And again, if you start developing abdominal pain in your left lower part of your abdomen, it could be diverticulitis. Thanks, guys.
I would say that he's right that some of the epidemiologic factors are age and sex, but the main thing is not getting enough fiber in the diet. So what we always tell our patients is the rule of 3 and 30, 3 liters of water a day and 30 grams of fiber a day. It won't guarantee that you'll never have an attack of diverticulitis, but it will lessen that chance. It's also going to lessen the chance that your diverticulosis will progress over time. Looking at some of these comments, Southpaw says that 6 weeks ago, I got diverticulitis for the 6th time, have a perforation and abscess, no improvement in pain after 3 weeks of IV antibiotics in a month of only eating broth. Scope next week. I would definitely be concerned that if there's no improvement in the pain after 3 weeks of IV antibiotics, that you could have complicated diverticulitis, meaning that there could be an abscess or a perforation somewhere. So I would definitely recommend that Southpaw follow up with maybe a CT scan to make sure that there's not any complication, given the fact there hasn't been any improvement over 3 weeks of IV antibiotics. Maddie says, so my mom and aunt both have this, and now I think I do, but my mom said I'm too young. I also have many autoimmune issues. Would that be hard to believe? We don't know how young Maddie is. She doesn't tell us, but it is true that we are seeing colon cancer, diverticulosis, diverticulitis, almost all GI conditions at earlier ages. So age alone does not rule out diverticulitis. Danny, I assume this is not his picture. This doesn't look like a 24-year-old. I was diagnosed in 2022 at age 24, so rather young, kind of like Maddie. I knew as soon as I Googled the symptoms, the pockets were not noticed by my GI on my previous colonoscopy and CT scan. Is that normal when not infected? Diverticulosis, even on screening colonoscopies where we're looking for polyps to take out so they don't turn into cancer, diverticulosis is still the most common finding on colonoscopy. So I think it's more likely, rather than not being noticed by the gastroenterologist, I think it's more likely that they simply neglected to mention it in their report because it's so common, and often for that reason, just not included in the report. They forget to include it, although it's really there. CT scans are fairly sensitive at picking up diverticulitis, but if it was not infected with just diverticulosis and the disease was mild, they may also have not seen it or neglected to put it in the report. Definitely possible. No exit 1, hospital again. Well, I'm back to the hospital again. I've had so many flare-ups, but most recently in September and got rid of that. Back again several months later in November and sent home with antibiotics that did not work. I came back several days later and was admitted into the hospital, and I've been here healing from the diverticulitis and sepsis, I guess. I can't have a colonoscopy until I'm completely healthy for 6 to 8 weeks, so that will delay surgery, but my question is, should I let them release me if I'm not 100%? Also, before they release me, they say that they want me to talk to a surgeon. What should I ask him? I'm having a good fair amount of pain still. A couple points that stick out to me, and that is the reason doctors say that you can't have a colonoscopy until you're completely healthy for 6 to 8 weeks is that doing a colonoscopy when the patient is actively infected with diverticulitis, there's a risk of perforation or creating a hole because the colon is weakened and acutely inflamed. So as a gastroenterologist, we usually like to let the inflammation and the infection be treated and cool down for a couple of weeks prior to getting a colonoscopy. In this particular case, I would be concerned because the patient's still having a good amount of pain, they're not better, and maybe they need to repeat imaging, like another CT scan, make sure the diverticulitis is not complicated with an abscess or perforation before they discharge the patient, because if it's not treated and the infection is ongoing, that can be life-threatening. Another TikTok video here by Dr. Suj. Let's see what this gentleman has to say.
It's also called diverticulosis, and it's caused when there are these little outpouches that form in the colon, usually down in the lower left side.
He's got a good British accent here, and does anyone know what he's wearing on the side of his head? I have no idea what that is.
One of the biggest things that causes it is constipation. So in order to try and treat it, we need to reduce the risk of constipation. Now, we worry about diverticular disease when some of these little outpouchings start to get inflamed and they can get infected, and that can cause really nasty tummy pain. It can cause bloody diarrhea. And if left untreated, it can even perforate, and the little pouch can pop. And then imagine all of your poo just starts flooding into your abdominal cavity.
I think he's mentioning that not all diverticulitis is created equal, meaning that you can just have a self-contained infection that can be treated with supportive care or even antibiotics if necessary. But if your pain is not getting better, if you're just doing supportive care and it keeps getting worse, or you're starting on antibiotics and the pain continues to worsen, you need to make sure that your diverticulitis is not complicated, as he's mentioning, with either an abscess or an actual perforation that would likely require surgery.
And that can be life-threatening. So the way that we try and treat that is to make sure that you are eating a healthy, balanced diet, lots of fiber. You can use things like psyllium husk or bulk-forming laxatives to essentially make sure that you just don't get super constipated. I mean, you're advised not to take things like non-steroidal anti-inflammatory drugs. This would be things like ibuprofen, naproxen, diclofenac. Also advised not to take opiates because this can increase the risk of constipation. And even if you have a great diet, let's say, and you're eating lots of fiber, or you're even using laxatives, these things don't work that well unless you are drinking loads and loads and loads of water. So send this to someone who gets tummy pain and is.
I like this a lot. I think he's making a couple of very important points. I would say that many of my patients ask me, how can I get enough fiber? What supplements can I take? And Benefiber, Psyllium, Metamucil, I think all that's fine. But technically, if your diet's on point, you really shouldn't be needing a supplement. A supplement is just that, right? A supplement. So shoot for 3 liters of water a day, 30 grams of fiber a day through your diet. And as I tell my patients, it's not possible to get 30 grams of fiber a day unless you're eating large amounts of fruits and vegetables. He also mentions that non-steroidal anti-inflammatory drugs like ibuprofen, Aleve, Excedrin, not only are those a risk factor for gastric ulcers, they cause all sorts of havoc throughout the GI tract, they cause inflammation, and can worsen things like diverticulitis and inflammatory bowel disease. Of course, any kind of opiates, right? Norco, oxycodone, and if you see people on heroin, what are they always complaining about from a GI standpoint? They're constipated, right? So definitely be very careful with the opiates and only take them if you absolutely need to. Feast 777. After a colonoscopy, I received zero advice or support. The specialist told me mid-examination that if I didn't change my diet, my bowel would not work by the time I reached 70. That was it. I think you need to get a new gastroenterologist. They shouldn't be talking to you in the middle of the colonoscopy, and they should explain your conditions and how it needs to be treated. Satori Bliss says, what is this digestive hell? Crying face. I was just diagnosed 2 days ago after severe pain, bleeding, chills, the works. Trying to recover from the infection and inflammation and just trying to figure out what kind of lifestyle changes I need to make so I can avoid this nightmare. If anyone has any advice or suggestions, please let me know. This pain and discomfort is horrible. Let's break this down into 2 aspects. Number 1, let's discuss post-diverticulitis care in the short term, meaning that for maybe 2 to 3 days, we recommend a liquid diet or broth to go easy. Days 4 to 5, slowly reintroduce small amounts of soluble fiber. And after about a week, you can go back to a normal diet. What type of lifestyle recommendations do we recommend in the long term to prevent not only worsening of your diverticulosis, but attacks of diverticulitis? Go back to the 3 and 30 rule. 3 liters of water a day minimum, and try and hit 30 grams of fiber a day. It's not possible to hit 30 grams of fiber a day unless you're eating large amounts of fruits and vegetables. We're talking things like apples, carrots, kale, spinach, oatmeal, all that stuff. From a GI perspective, personally, I consider our bowel movements to be the 6th vital sign. It shouldn't take very long, a couple seconds at most to have a bowel movement. It should be well formed, no pain, no straining, no bleeding. Our bowel movements are usually a reflection of 3 things. Going back to what we just talked about, the amount of fiber we eat, the amount of water we drink, and the amount of exercise we get on a day-to-day basis.
So I had another question.
Let's see what Dr. Eric Berg has to say. This is a common question we get in patients who have diverticulosis and diverticulitis, and that is, should I avoid seeds, nuts with diverticulitis?
Should I avoid seeds and nuts if I have diverticulitis? Okay. Well, first of all, what is diverticulitis? It's a condition where you have inflammation in your diverticuli, which are these little pouches in your colon, and this idea that if you consume seeds or nuts, they're going to kind of lodge in there and irritate it and create more problem. That is a total myth. Seeds and nuts do not create inflammation in your colon. Okay.
Conceptually, it makes sense, right? I can see why people thought that you should not eat nut seeds or popcorn if you have diverticulosis or diverticulitis, but he's absolutely right. It's been disproven. Not only can you should. Check out the nutrition facts on popcorn sometime. It's one of the highest fiber foods out there.
They don't cause diverticulitis. Diverticulitis comes from consuming foods that are very inflammatory, like the grains, like the bread, the pasta, the cereal, the crackers, those foods.
So strong disagree on this point. I think whole grains are actually very, very good for you. They decrease your blood pressure. They're high in fiber. So if anything, they prevent diverticulosis and diverticulitis. Now, of course, no one's condoning sugary cereals, of course, but the whole grains are definitely beneficial.
Vegetable oils like corn and soy oil in your salad dressing, highly inflammatory omega-6 fatty acids. Of course, sugar is very inflammatory. If you have insulin resistance, you're going to have a lot of inflammation. So just by getting on keto and doing intermittent fasting especially, you can heal the inflammation in your colon. 95% of...
Strong agree with the intermittent fasting. Pretty strong disagree with the keto diet. I see thousands of patients in clinic. My main complaint with the keto diet is that almost invariably the patients are not getting enough fiber. Typically, a keto is somewhat synonymous with low carbohydrate, and so very few of my patients on a keto diet are getting enough fiber. That's my main complaint. But intermittent fasting, yeah, 100%. That's how our ancestors were. It's very good for you. You can go many days without eating and be perfectly healthy. No problem.
People that have this have it in the lower part of their colon, the last part called the sigmoid colon. It's in the left lower area right here. And some foods that are really crucial would be all the leafy greens, which have chlorophyll. Chlorophyll is a great healer of the colon. Wheatgrass juice powder also really will help. Cabbage, any form of cabbage, whether it's sauerkraut or just regular coleslaw or cabbage, has certain things in there that are really good for the colon. Okay, it's good for acid reflux as well. Fermented vegetables are really important, like pickles, sauerkraut, kimchi. Really important to provide the right food for the microbes that will also help you, because a lot of times this condition happens after you take antibiotics. You wipe out all the good bacteria.
So I like some of the things he's saying. I have a strong disagree with others. Diverticulitis does not happen after antibiotics. You treat diverticulitis with antibiotics. Antibiotics are indicated and necessary in many cases, but a necessary evil. I think what a lot of my patients and people in the general population don't realize is that each one of us has more bacteria in our bodies than we have human cells. We are literally genetically more bacteria than we are human. So whenever there's a disruption to that microbiome inside of us, whether you get a infection, infectious gastroenteritis, or you take antibiotics, it's like dropping a nuclear bomb on your microbiome. And it can take many weeks to months to slowly re-equilibrate. That's why we commonly see bloating, pain, change in bowel habits after a course of antibiotics. It is true that fermented foods may help to reconstitute your microbiome more rapidly. It is also true that you need to nurture your microbiome, whether it's sick or not, to maintain a healthy gut. What do the bacteria in your colon like to eat? They like and they thrive on the prebiotics. Prebiotics are essentially fiber. So not only the amount of vegetables that you're eating, but also the variety of vegetables. Each of these species in our colon, of which we have tens of thousands, thrives on a different prebiotic, on a different type of fiber. So increase not only the amount of vegetables, but perhaps more importantly, the variety. Our microbiome turns these prebiotics into postbiotics, which are the short-chain fatty acids that's necessary for a healthy colon. So 100% agree on the fermented foods and only take antibiotics if absolutely necessary.
Yeah, and then you have all these inflammatory conditions, so you have to build that back up. All right? Thanks for watching.
So another post here by GeoHo, mild diverticulitis or colitis. Hey everyone, sorry to bother again, but I had a question. On my CT scan document from my hospital trip, it said mild diverticulitis versus colitis. Is it possible they won't know for sure until I've had my colonoscopy? Finished my antibiotics and no food causes me real pain like that. But then again, I never had severe lower abdominal pain to begin with or blood in the stool. Just wondering, is it possible I won't get a definitive answer until my colonoscopy? Yes, you are likely not to get a definitive answer until your colonoscopy. Anything with itis at the end just means inflammation. So the radiologist is saying that they can't tell if you have an infected diverticulum, i.e. diverticulitis, or if you have an infected or inflamed colon, meaning colitis. It's important that you get a colonoscopy not only to differentiate between diverticulitis and colitis, but also to make sure you don't have colon cancer. There's many different types of colitis: infectious, ischemic, inflammatory like ulcerative colitis or Crohn's. So definitely you need a colonoscopy. That is necessary to differentiate between diverticulitis and colitis and to make sure you don't have colon cancer. Nurse Ratchet says, should I skip the colonoscopy? I had a nasty flare of diverticulitis beginning of July. I went to the emergency room and got some IV medications. A CT scan was released with antibiotics and a few Vicodin. I had a little follow-up with a GI doctor and she scheduled a colonoscopy that is set for December 1st. I really want to cancel it. I've been fine since. I was going through a hard time at the end of June due to grief and not taking good care of myself. Also, that ER visit has already cost me $5,500 and the colonoscopy will be another $1,100, and that's with insurance. I know most people here aren't doctors, but what do you think? I think that these prices speak to how, in some ways, messed up insurance is in our country, but I would nevertheless still strong recommendation for a colonoscopy following any attack of diverticulitis. As we alluded to in the previous post, it's imperative that you rule out colon cancer. Believe it or not, the radiologist has a tough time telling the difference between diverticulitis and colon cancer on imaging. It's also valuable to look at the severity and the extent of diverticulosis. So a colonoscopy is a strong recommendation, but after some time for the infection to resolve and be treated, so usually 6 to 8 weeks after diverticulitis is when we start recommending a colonoscopy. A little academic here, but this is a good article from Journal of Clinical Medicine. Diverticulitis is associated with an increased risk of colon cancer. An association between diverticulitis and colon cancer has been proposed. The evidence is conflicting, and the guidelines differ regarding recommended follow-up with colonoscopy after an episode of diverticulitis. To guide regimens for follow-up, this study aimed to investigate if patients with diverticulitis have an increased risk of colon cancer. They looked at over 29,000 adult males and females with diverticulitis and over 145,000 controls matched for sex and age. The incidence proportion of colon cancer was 2.1% in the diverticulitis group and 1.5% in the matched control groups. And it's important here that the confidence intervals do not overlap. So there was a statistically higher chance of having colon cancer after an episode of diverticulitis. In conclusion, the risk of colon cancer was significantly increased in patients with diverticulitis 0 to 6 months after the initial diagnosis. So in summary, a couple things that we've learned. I think number one, to prevent diverticulosis and diverticulitis, the key is a high fiber and high amounts of water. We're talking about the 3 and 30 rule. 3 liters of water a day, 30 grams of fiber a day. It's important to recognize that all diverticulitis doesn't necessarily need to be treated with antibiotics. If it's mild and you're healthy and the patient's healthy, you can do supportive care, although antibiotics are not wrong. If the antibiotics are given, Make sure that they give you an appropriate regimen. It needs to cover both gram-negative and anaerobic bacteria. Typically, we see either augmentin, which will cover both, or a combination of ciprofloxacin and flagyl, which is metronidazole. If you have repeat attacks of diverticulitis, surgery is not wrong. They cut out the affected segment of colon, which is usually the sigmoid colon, the most distal part, and in many patients that can be curative. Always make sure to get a colonoscopy after an episode of diverticulitis, unless you've had one within the last 6 months to a year. It's imperative that you make sure there's no colon cancer there. They go in, take out any polyps, and then you can be reassured that there's no lurking colon cancer that's not actually masquerading as diverticulitis. Hey, I appreciate you taking the time to watch this video. I hope you learned something. For me, it's educational, seeing how patients think about these disorders, and it gives me guidance in how to talk to my patients in clinic. If you have any questions, go ahead and ask below. I think the next video, I'm going to talk about hemorrhoids. I know bunches of you out there have hemorrhoids. I know that because I see it all day, every day in clinic. So stay tuned to hemorrhoid videos coming soon. Otherwise, I'll see you in the next one.